know better than me, sometimes don't want to go get checked because they think it may only be indigestion and fear of being maybe embarrassed for trying to go and get checked, when in reality, there's nothing wrong with that. You'd rather be checked than not, right? I mean, do you see that a lot?
Actually, yes. I had a patient one time came to the ER. She was told by her daughter she needed to be seen because she kept popping Tums and saying it was indigestion and it wouldn't go away. And she walked in and she's like, I'm fine. I really am. My daughter made me come. So we're like, okay, let's just get a quick EKG. And she was actually having an active heart attack. And her
That's
only
crazy.
symptom was, I feel like I just have heartburn.
Oh my gosh. Have you seen the same thing, Shawnette?
Absolutely. Lindsey and I worked together in the cath lab and ICU, and we had many patients, women, who, that was the last thing that we thought based upon what they complained about. Like she said, they complained about indigestion, vague back pain, abdominal pain, I'm nauseated, things like that. And, if until we do that EKG, you know, you don't think of that as the etiology for those vague symptoms.
Yeah, definitely. I think that's why things like this are important, to kind of let people know this is what happens, because if not, they may do the same thing. So I definitely can see how people would think that, but definitely important to get checked out for sure. Well, so what can we do? I'll ask you, Shawnette, while we're still talking to you, to lower our risk of heart disease and stroke.
Well, there's a few things that play a role in that. Family history. Unfortunately, there's not a lot we can do about that, but the things we can modify is making sure that our weight stays stable, not to gain a lot of weight. If we do have risk factors like hypertension or diabetes, make sure those things are very well controlled. And the biggest thing is not to smoke. If a person is a smoker, they should not. That is a very high risk for heart disease.
Yeah.
Yeah, for sure. I know we hear about that a lot too now with vaping and whatnot too, because obviously that's a big thing now as well. It may not be depending on the age, but I know it's something that's definitely popular now. So I think that, knowing that that's important to watch out for as well, just like regular smoking is also important. So, all right, well, I got a text that we have a couple questions. So I'm going to go ahead and ask those questions to you guys. So I'll go to Lindsey this time. Lindsey, the question is, what are the options for menopausal women to decrease their risks of heart disease?
So to decrease your risk of heart disease, it would just be the same as risk factors: your blood pressure control, cholesterol control. Being on hormone replacement therapy alone is not a treatment for heart disease, but it has shown to reduce calcium buildup over time in women that are postmenopausal. So again, remaining physically active, controlling your blood pressure, controlling your cholesterol, heart healthy diet's very important.
Okay, good. One other question, Shawnette, I'll ask you this one. Does race play a factor in heart disease in regards to menopause?
Not necessarily. It really kind of goes back to what are your risk factors for heart disease? It goes back to that. I actually read a study that said that heart disease is the biggest killer in African American females, but also in Caucasian females too. So it's not like, it's more of, one versus the other. Just like Lindsey said, the only, you have to really get with your doctor. You and the doctor that's prescribing any hormone therapy, you really need to go over your family history with them. They need to look at your risk factors for heart disease, how much benefit this medicine is to you as opposed to the risk. If you're a person that's very obese, and it doesn't matter the race, but if you're very obese, you're sedentary, like Lindsey said, and you're not active, you have diabetes and all of these risk factors, then that would be something that you would really have to discuss with your doctor, because those underlying things just put you at risk for heart disease, period.
Great. And if you have any other questions, please feel free to put them in the chat box. We appreciate you interacting and asking questions. So I think, like Lindsey mentioned, you need to look at different aspects of your health, right, to make sure that you reduce your risk for heart disease and stroke. So we're going to jump over to Julie. And I, Julie, ask you I'm sure the question that everyone likes to ask, and that is wine really good for your heart? And if so, which ones? Because we all want to know.
We want that answer to be yes.
Right.
And that answer is yes, because wine is something that we love, and it does have health benefits as well, especially when it comes to heart health. Now, the rule there is usually not to be a no fun Betty here, but the rule is 1 to 2 4-ounce drinks a day is considered healthy for heart benefits. And what they know about certain wines is that they have antioxidants in them that actually can improve your heart health. So there is some benefits as long as your weight can tolerate having some wine. What they usually recommend is that you don't start drinking just to prevent heart disease, but that if you enjoy wine, do it so in moderation and definitely incorporate it into a healthy diet.
And I remember, I think that the amount you can drink is different whether you're a man or a woman. Is that right?
Yeah, that's not really
I'm not saying I'm going to change. I'm just.
No, it's just they get more than us. They do.
But that's what I thought. I thought they could have double what we can have, basically.
Yeah, it's really double. But they say for us to stay safe in that 1 to 2 4-ounce drinks a day, or you could say 1 8-ounce glass, which is a nice New Orleans size wine glass.
Right. That makes sense. So then flipping over to the food aspect, what do you need to look at in your diet to help promote better heart health?
So as the lady said before, it's the best thing that you can do to protect your heart is to maintain a healthy weight. And that's something that you want to evaluate first. How do you maintain a healthy weight depends on you, your choices, what your body needs. Doing things that will work for you long-term is the goal, not eliminating foods that you can't continue to ignore. You want to make something that's very realistic and maintainable. But if you can incorporate things into your diet that will help you, it would be things like fiber, fruits and vegetables of all different colors. Don't pick the same colors all the time, but a variety of fruits and vegetables. Consuming as many raw vegetables as possible. That way you're getting the fiber. They know that helps lower cholesterol. And so when you're eating all that fresh fiber from fruits and vegetables and from the earth, it does help lower cholesterol. And then protect your heart also by protecting your blood pressure by consuming low sodium foods. So that's anything that's high in salt or even adding salt to your plate. If we can eliminate those, it keeps your heart in a safer zone as well. And then if you are incorporating healthy fats into your diet, healthy fats would be olive oil, avocado, nuts, seeds, salmon. Those products that naturally have good quality fats in them will help usually protect your heart as well.
And I wonder, thinking about all the different types of things you're supposed to eat. I know when I go to the grocery, I kind of get confused sometimes, right? Of what the labels are saying. At one point you want to look for low fat. Now it's low carb, low sodium. What would you recommend to people when they're looking at the labels when they go grocery shopping? Like, how do you figure out the best things to look at and make a good decision?
Right. Well, the first thing is it's important that you do pay attention. So just by simply reading labels alone makes a difference on your purchases and your awareness of the foods that you're consuming. So yes, it's overwhelming. Even as a dietitian, I get overwhelmed sometimes in the grocery store, but it is important to just pay attention. Everybody's paying attention to different things. And again, that goes back to you and your individual needs. Some people are paying attention to sugar. Some people are paying attention to total carbohydrates because maybe they have, they're diabetic or they're trying to watch their weight. Some people who have high blood pressure would pay attention to sodium. Somebody who is maybe with allergies would pay attention to the ingredients and what's in those. But the bottom line is whatever you're individually looking for, you want to make it a priority that you're not just purchasing something because it's on sale or because this is what you've always bought, that you are purchasing something because it has some sort of health benefit to you.
That makes sense. We have a question for you.
Okay.
So Julie, they want to know, is one type of wine better than another? So I think they're saying white versus red.
Right. So what they know is that the red from the red grapes does have the antioxidants in it that are supposed to protect your heart. So yes, red is typically better than white. But again, all in healthy moderations and in what you enjoy. but the red does benefit your heart more than the white.
Okay. And then the other question was, is there a particular olive oil to use?
So olive oil is from choice. So it really varies with the flavors. What I try to always recommend to people who are using olive oil is to try not to heat olive oil. It's just not meant to be. A lot of people started sauteing with it and kind of using it for cooking when they heard it was healthy. Olive oil is meant to kind of be in the raw. So if that means you're consuming it on top of a salad or adding it as a marinade late in the cooking process, you'll get the most health benefits from that.
I didn't realize that.
No, we ran with that when we started cooking with it.
We cooked everything in olive oil for a while, so I'm guilty of that.
If you are cooking with olive oil, you do a quick cook. It's not one that you're sauteing for a long period of time. They know that that's just not the best way to use olive oil, to use it raw if possible.
Okay. And then is there a way that you can prepare your food properly to help cut down like the added fat, the added sugar, the sodium, the salt?
Right. So it starts in the grocery store, obviously making good choices there, what you're purchasing, making wise choices. And then when you bring it home to your kitchen and you're cooking there, trim any excess fat off, take the skin off, bake, grill, broil, saute, however you decide to do it. Just try to avoid adding tons of extra unhealthy fats that we're typically used to doing here in the South. Just find ways to eliminate some of those unhealthy and add in some of the good quality ones that we talked about.
That makes sense. Okay. Well, we know that obviously eating healthy and having some wine is not necessarily a bad thing, but we also know we have to kind of get moving, right? So Elizabeth, how does exercising help improve our overall health?
I think that's a really good question. There's so many benefits for exercise, but specifically for heart health, it's going to help decrease and manage your blood pressure, and it can even decrease your blood pressure by 5 to 7 milligrams of mercury. In addition, with exercise, even 30 minutes a day, we do see reductions in overall cardiovascular disease risk, as well as a 20% reduction in stroke risk. So we see a dose-response relationship with exercise and health outcomes. So the more that we do, the better benefits that we receive. In addition, you will see improvement in your lipid profile. You will have increased HDLs, decreased triglycerides. In addition, it will help if you are diabetic to control your blood glucose, which is very important as well.
Great. And why is it important to get your heart rate up during exercises? I know I'm always looking at my watch and seeing everything that's going on if y'all have the Apple Watch or Fitbit, but why is that important?
That's a great question. We all have monitors nowadays, and there's a good discussion going on about exercise and its benefits, but why heart rate specific? I guess the first thing that sets it apart is what is exercise compared to physical activity. So usually we see that we want to do any type of activity that increases our heart rate. That's aerobic exercise. When we are doing activity that is just not resting, where it may be more leisurely, like physical activity around the house, doing chores, there's benefit to that. But typically, as we increase the intensity of the movement, we see increased benefits. In addition, with moderate to vigorous intensity being instilled, we're going to see some changes that occur in the heart itself. So you'll be at a higher cardiorespiratory fitness. Your heart is a muscle. It will get stronger. It will get more efficient at delivering oxygen to your skeletal muscle. And honestly, the benefits of exercise in general are infinite. Decreased risk of falls, decreased risk of frailty, especially after menopause, preventing risk of osteoporosis. But of course, especially in times like these in a pandemic, really important as well for your mental health, our cognitive function, and decreased risk of depression and anxiety.
For sure. It looks like we have another question. Let's see. This is for you, Elizabeth. Is the treadmill equivalent to outside running on tracks? Oh, it just went away. Hold on one second. I'm sorry.
Oh, I see it.
You say it? Okay, sorry.
It's a treadmill equivalent to outside running on tracks or streets. So I think what this person's referring to is the intensity the same. It is a little different since on a treadmill you are just matching the pace versus running outside or on a track, like you are physically propelling yourself forward. I would say it definitely can be, but you will have to play with the speed and the incline to mimic the intensity that you would match on pavement or a track. I hope that's helpful.
Hopefully so, yes. And are there specific or which exercise activities are best for improving heart health?
In general, we're going to see recommendations for aerobic exercise. Currently, the recommendations for older adults and healthy individuals generally are 150 minutes a week of moderate intensity exercise and 75 minutes a week of vigorous exercise. So if we don't have a tracker, a way we can tell if we're working at that intensity is based on how we feel. So for moderate exercise, you're going to feel your heart rate increase, your breath frequency increase, but you should be able to do the activity for a sustained period of time. When it is more vigorous, it is going to be harder to talk. Your breath frequency will be faster and your heart rate will almost feel like it's pounding a little bit more. When we do work at higher intensities, you don't have to work as long. So with that aerobic conditioning, we see a lot of great benefits, including increased cardiorespiratory fitness. However, I will also say that strength training is very important as well. It will help specifically with insulin sensitivity, and it's very important for women after menopause to decrease risk of fractures.
That's great. I was going to actually ask you that if strength training was kind of just as good or as important as the aerobic.
It definitely is just as important. We always see that with combined exercise, meaning incorporating aerobic and strength training, we see the best benefits. Aerobic training you can do almost every day. Currently, the recommendations are 5 to 7 days a week for aerobic training and at least 1 to 2 days a week of strength training for all your major muscle groups.
Okay. And what if you don't exercise regularly yet? You know, how do you begin? What do you do?
I mean, those recommendations can be really, really daunting if you're not doing anything right now. 150 minutes seems like a lot of time. So I think the first thing is just take a breath and take everything slow. So if we currently aren't exercising, there's nothing wrong with that. You want to start, and that's the best place to be. So even if you can't spend 30 minutes, we can spend small increments of time. So if you can accumulate 10 minutes of exercise throughout the day, let's say you do one before work, one at your lunch break, and one after dinner. That could just be a brisk walk. You've already accumulated 30 minutes of exercise. It doesn't have to be all in one session. And it's really hard for everyone who is working and has multiple tasks to dedicate an hour a day to exercise. I also think that just focus on one goal at a time. If we try to do everything at once, it will almost set us up for failure. We want to progressively start to exercise. So maybe if we don't or currently aren't, we can start with maybe 2 to 3 times a week. We can do incremental where we accumulate during the day, or you could do maybe 20 minutes and then every week increase a few minutes. Once you're able to do that consistently, you can consider increasing the frequency or increasing the duration.
That makes sense. Well, how should you safely exercise?
These are all good questions. It is a very big topic for safety. So first, you just want to make sure you're wearing the right attire. So you want to wear something that's lightweight, breathable. You should be able to sweat. so that your body can thermoregulate properly. In addition, we want to wear comfortable shoes. So if we are running or walking, we want to make sure that we have enough cushion, especially if you pronate or supinate or you need any type of insoles in your shoes. That's something to consider. In addition, we need to hydrate. So we hydrate during, before, and after exercise. And I see a lot of times that when we're new to exercise, we don't always think about eating beforehand. And maybe Julie can touch on that in more detail, but generally 2 hours before exercise, you can have like a full meal, and 30 to 40 minutes before you can have like a small snack, just so that you have enough energy to sustain that movement.
That's definitely good to know. I've actually been in an exercise class where I have not eaten before, got lightheaded, and ended up having to leave the class because I felt like, I just couldn't do it. So I'm curious, Julie, like Elizabeth was saying, what should you eat before you exercise, whether it be a snack if it's 30 to 45 minutes before, or a meal? Are there certain things you recommend?
So Elizabeth's exactly right. Usually your bigger meals would come at least 90 minutes before an exercise, just because when you're exercising and you've eaten, your body is focusing, your GI system is focusing on digesting food. So it's not focusing on the rest of your muscles. And it's all your blood flow is kind of going to your GI system. So you could feel very full and gassy and other GI issues. And then you've got the complete opposite. Whereas if you didn't eat before an exercise, you can feel lightheaded, low blood sugars, especially if you're diabetic or experiencing hypoglycemia events. So a little snack beforehand usually is almost perfect timing, usually about 30 minutes. Most people try to enjoy something headed to the gym with the car ride to the gym. Something quick and easy, maybe an apple and a cheese stick. I mean, that's easy, portable, ready to go. It may be a banana and a little bit of peanut butter. Just some sort of carb and protein ratio usually works well. And that way you're finding a balance of energy, but also fullness, not overly fullness, but just enough kind of satisfied to get you through the workout, because nothing cuts a workout short if you're hungry. If you are hungry, you will go home quick because that's all you can think about.
Right, for sure. All right. And I know that I think after I had that happen to me at exercise, I had a protein bar, usually 30 to 45 minutes before, just to make sure I was okay.
Yep, you learned your lesson.
Learn my lesson. Okay, so there is another question. Let's see here. Okay, this is going to be for either Shawnette or Lindsey. So I guess I'll go Shawnette first. Are there any female-specific disorders that increase a woman's risk of heart disease?
I kind of thought about that, and one was menopause, because men don't go through menopause. The other is pregnancy too. Over time, not when you're 30 years old. When you're 30 years old, your risk for MI or heart disease is it's a very low risk. However, when you develop things like gestational diabetes, hypertension at a young age, sometimes you tend to develop those things when you get older. And those things are risk factors for heart disease. So that's basically what I thought about for women specifically.
That makes sense. And then Lindsey, does taking birth control raise the risk of developing heart disease?
So taking birth control alone doesn't raise your risk for heart disease, but for some women, birth control can give you high blood pressure. And high blood pressure in combination with birth control increases your chances for heart disease for like 20%.
Oh, wow. Okay. Lindsey, when should you see a cardiologist?
You should see a cardiologist if you have risk factors such as diabetes, obesity, high blood pressure. Family history is a big one, especially early. If somebody in your family had a heart attack in their 30s, 40s, or 50s, you should see a cardiologist sooner rather than later. You don't want to wait till you have symptoms.
That makes sense. Okay. I'm going to open it up and see if there's any other questions. If anybody has any, please feel free to type them in the chat box. And if I get any more texts with questions, which, oh, I just got one. So here we go. Let's see. Who's this for? How about Shawnette? What about COVID-related heart problems? If you had or have COVID, are you more at risk for heart disease?
Well, what we saw with that was it was more not necessarily heart disease, but the COVID did cause people to have more blood clots. So, that can put you at risk for having a heart attack, not necessarily heart disease. And also, people had more arrhythmias that were associated with COVID, like irregular heartbeats, atrial fibrillation, things like that. That was more associated with COVID. We saw more clotting problems with COVID. Like I said, not necessarily heart disease in the sense of forming blockages or anything, but because of the propensity to form blood clots, that's what made the risk higher if you already had those other risk factors or if you already had heart disease to begin with. Like if you were a person that had stents or you have mild coronary disease or something like that, that would be, that got COVID, that person would be more at risk for like heart attacks, not more heart disease.
Okay, that makes sense. This is for all the panelists. So you can just obviously take turns. What would you say is the number one most important thing you want the viewers to know about heart disease?
Okay, I'll go first.
Lindsey, you can go.
Oh, okay. Go ahead, Lindsey.
Okay, I'll go first. The most important thing I would want viewers to know is to not avoid or not ignore these subtle symptoms. I know I said reflux earlier, but fatigue is also a major sign in women. Rosie O'Donnell, she had a heart attack and her only symptom was fatigue. So just know your body, and don't be afraid to come to the doctor or the ER, even if it's just reflux or you're tired. Make sure it's not a heart attack.
For sure. Who wants to go next?
So, I think that's a great question. There's so many things, as Lindsey previously mentioned, about heart disease that we can't control in terms of risk factors. We can't change our genetics or our family history, but what we can change is our activity and our dietary intake. So I would say, even if you're not in a place to start exercising regularly, you can just consider breaking up your sedentary time. It's something very small that you can do, something we can all do, just getting up maybe once every hour, 2 to 5 minutes, just light exercise or light activity, taking a flight of stairs instead of taking the elevator, walking out around a little bit. That has great health benefits and will definitely increase or decrease any CVD related mortality or premature mortality. So even if you're not quite at that place to start, that's something small that you can do.
Okay,
And
I'll go.
okay, go ahead.
Oh, good. We have the same thought. To me, it just makes sense that you want to take care of your heart. It's one of the most important, I would say, the most important organ in your body. It makes sense that you want to treat it well and do what you can to control it. Just like Elizabeth said, there's so many parts of this that you can't control, but paying attention to what you're eating, get moving, make it a priority, just like you would anything else. Make your heart health a priority. Check in with your doctor regularly like you're supposed to. Maintain a healthy weight. Just give your heart a good chance. It deserves it.
For sure. I like to always say it's 80% preventable when I talk to people. I know y'all all know that. So it's outside of family history, right? So, Shawnette, what about you?
Well, just piggybacking off of what Julie said, um, I think the most important thing that people need to do is stay in touch with your doctor. Follow the treatment regimen that they have given you if you do have those risk factors. If you have diabetes or heart disease, or hypertension, control those things. Do stay with your doctor and get a good plan. If you have problems with your medications, talk to your doctor about it. Don't just ignore it, or well, I'm just not going to follow the treatment plan. So I think it's very important for, like Lindsey said, all of us, we should pay attention to what's going on with us. But when we do have a plan, we need to try to our best to stick to it, stay in touch with our doctors, let them know what's going on with us so they can be a part of the plan. And also, I think one big thing is please don't smoke. We have so many patients that, they don't realize the the problems that they're causing for themselves by smoking. It's a risk factor for heart disease, stroke, lung disease, peripheral artery disease. Right now, my mother is dealing with that issue: smoking and peripheral artery disease. It leads to amputations and all kinds of other terrible things. So, if a person is a smoker, I really, really try to put to them how important it is not to smoke.
For sure. Well, I think that might be all of our questions. I know I enjoyed myself. Thank you so much to all of you, all the panelists, for answering the questions, having a little wine with us and letting us know that wine is healthy. Julie, women's heart health is top of mind in February. It's Heart Month, but these problems can happen any time of year. So we want to encourage everyone to watch and be proactive in their health and to invest in yourself and your well-being. Thank you so much for joining us tonight for our virtual Women's Heart Health and Wine event.
Nicole, I just saw a question.
Oh, a question popped up?
Yeah. Did you
Hold
see
on.
it?
Nope. Oh, there's two questions. I'm sorry. I was getting text from someone else about it. Okay. Let me ask these last two questions. Are you guys good with doing that? Okay, great. So let's see. Can you repeat what benefits occur to lipids, triglycerides, etc.? Also, does a sharp chest pain once require a doctor visit? Lindsey?
So the benefits of controlling your triglycerides and lipid, that's sometimes it's familial, genetic, so you can't necessarily control it with diet and medications, but it's very important to keep your, what we call LDL, your bad cholesterol controlled. That's the cholesterol that could seep into the lining of your heart and cause blockages later down the line. But sometimes due to genetics, you can't necessarily control that. So there are medication options, statins. There's a new medication called Repatha or Praluent, it's a PCSK9, and triglycerides as well. Try to keep that down. We're talking about wine, but you don't want to overdo it because sometimes it has a lot of sugar in it and can increase your triglyceride level. So keeping your blood sugar controlled can lower your triglycerides. The sharp chest pain once requiring a doctor visit, I think it's worth mentioning to the doctor so we can keep a log of it, a record of it to see if it occurs. It depends on if it's at rest or with exertion. Sometimes those things matter. But just a one-time sharp chest pain that lasts a couple of seconds, we'll never know what that is exactly. But definitely keep a log of it. And if it persists, continues, gets worse, it's warrants a visit to the doctor.
We have one other question that I see, and that is, I have a right-sided aortic arch. Any suggestions outside of what has already been mentioned would my plan change? I see my doctor regularly, but does my condition place me at a higher risk for heart disease? Shawnette, you want to take that one?
So right-sided aortic arch.
Correct.
So that's really an anatomical thing. And I don't think that that puts you at risk for increased heart disease or make more blockages. That's just something that, you were born with. It's something that should be monitored, of course, but just like we do for everything else. But I think it's just more of an anatomical issue and not more of I'm going to make more blockages because I have that issue.
Okay. Okay, good. Well, if you have any more questions, feel free to leave them in the comments and we'll reply back and answer those questions after this live session has ended. Again, thank you everyone for being on the panel. Thank you everyone that's joined and participated and for all the questions. We really appreciate the engagement. So hopefully we'll see you in person next year. Thanks so much, guys.
Thanks.